The patient's name is Jane Doe. She's 16 years old, has cystic fibrosis, came from the ED last night with a collapsed lung, so she's been having trouble breathing. And basically, she's supposed to have surgery at some point, but the doctor beat down and he'll fill you in, I guess. But just so you know, the mom, she's just awful. She's constantly asking for things, and you have to go in her daughter's room like 20 times, and it's just, you can't abuse her. She's just all over the place. Like, I can't even handle this anymore.
Do you know what time that procedure is going to be about?
No idea, but like I said, the doctor will be down here. He'll help you out.
What about her breathing and
it's fine.
her 2 sets?
It's fine. I can't handle this anymore. So good luck. Have fun.
All right, better get through this. We've had a rough night in here.
Well, I called on the nurses all the time, and no one came in to help us, and the PCAs were terrible, and no one would bring her blankets or get the nurses when I asked. So yeah, it was a terrible night.
Well, this is a hospital. Nurses are always busy. Everyone's always busy. They have a lot more patients than just you guys, so I hope you understand.
Well, we had a rough night in the emergency department, so I would appreciate a little bit more sympathy on your end.
I am getting you sympathy. I understand that it's hard, but you have to understand that there's way too many people to focus on just you guys. But we're doing our best.
All right, well, do whatever you need to do then.
Okay. I'm just going to get your blood pressure real quick and it'll be vital.
So does she had medication due like 30 minutes ago. Is someone going to come in and bring that? Like, we need to be on schedule and keep up with her medicine so she's feeling better.
None of her meds are due yet. She still has 45 minutes for her next med. But just let us do our job and you can do yours. So just let us work.
Whatever. Do what you're doing.
Okay.
So what's the plan for the day? Are the doctors coming up soon?
Yeah, they'll come up soon. She's having some type of procedure.
A procedure?
Yeah.
What are you talking about?
I'm not really sure. It's help with her lungs or something, but I don't know.
Why don't you know anything more about it?
That's not my job. That's the doctor's job, so you can just wait till they come in here. So.
This is just ridiculous. I don't understand why you don't know anything. You don't know when her meds are due. You don't know if she's having surgery today.
Well, I'm about to do a full assessment on her, so you need to leave because I can't.
I'm not leaving her alone with you.
I can't be doing this with you.
This is ridiculous. I'm going to go talk to your supervisor because I just cannot handle you being in here all day.
You know what? I'm just going to leave and I'll come back for you guys in a little bit.
She is having trouble breathing. What are you going to do about that?
Respiratory with you. I'll go get him real quick.
So the patient's name is Jane Doe. She's 16, has cystic fibrosis, came in from the ED last night with a collapsed lung. She's supposed to be having surgery today. And then what they're going to do is just connect part of her lung to the chest wall just to keep her lung nice and open so that she can breathe easier and prevent another lung collapse. So they should be coming in at some point to talk to the patient and her mom because her mom's in the room with her. So they'll just be coming and talking about that. Just some medication that she's on. She has albuterol, so it's just every 4 to 6 hours just to keep her lungs nice and open. And she's also on Holmazine. It's taken 1 to 2 times daily, just to thin the mucus so that she can breathe easier and everything. So her morning dose for that should be coming up soon, so just so you know that should be coming up. Just so you know also, her mom, she's always in the room with her. She can be a little bit of a handful, but you have to understand that she's just worried about her daughter and everything, so just try to be as reassuring as you can and just explain everything as fully as you can and just know that it all comes from a good place. She's just a little bit worried.
Okay. How was her breathing throughout the night and her O2 stats?
Her breathing's a little bit labored and her O2 stats are hanging around 89, 90, so just make sure that you're watching those and everything's good with those.
Okay, thank you.
All right, yeah, good luck. Have fun.
Thank you. Hi, I'm Nate. I'm going to be your guys' nurse today. How was your night last night?
It was kind of rough, honestly. The nurses didn't come in when I asked, and the PCAs were not very helpful, and they didn't let the nurses know that we needed anything. They weren't very vigilant about getting the meds in on time, and it was kind of a rough night.
That's definitely understandable. It's a hard situation to be in. I heard you didn't get much sleep last night.
No.
Okay. Well, I can assure you we're going to do everything we can so you guys have a comfortable stay while you have to be here. We actually have a comfy chair, and I can get you some pillows if you want to take a nap or something.
That would be great.
Okay, cool. I'll get that for you as soon as I leave then.
So when are her morning meds going to be due? Shouldn't they have been in here a while ago?
Her pills are actually due in about a half hour. She can use her inhaler as needed though. Are you breathing all right?
I'm having a little bit of difficulty.
a little bit of difficulty. Okay, I can go get you your inhaler then until your pills are ready. Okay. So, plan for today is the doctors are going to come up and talk to you about surgery for your lungs while you're having trouble breathing. Basically, it's small, it's collapsed a bit partially, and that's why it's so hard for you to breathe. So, what they're going to do is they're going to attach your lungs to like the side of your chest cavity, basically make it bigger, and you should have a lot better of a time breathing. So, if you have any more questions or details about procedure or how long it'll take, they'll be up soon. You can ask them questions before, see if you want to do it.
Okay. So what time is she going to be going down for surgery?
So, if you decide you want to do it, it would be about 4 o'clock today. So you'd be in pre-procedure at 4, and then we'll go from there. It'll probably take a couple hours. Okay. I'm going to do a quick assessment on you. Would you like your mom to stay, or do you want some little bit of privacy?
She can leave.
Okay. We actually have a break room. There's coffee, snacks. It's pretty relaxing. We have it for our families because we know it's hard to cook sometimes. So if you want to go get coffee or a snack, and then I can do the quick assessment.
Is there anything we can do about her having so much trouble breathing? Because sometimes her inhaler isn't very effective.
Okay. Yeah, I'll call respiratory. I'll stay with her until they get down here. So if she has any problems, I'll make sure I address it. But I'll definitely stay with her until they get here. You can see what they can do for her.
Okay, I'll be back in a little bit.
Okay. So you start out by listening to your heart a little bit.